Hey guys, welcome back to the channel. I want to take a moment to explain the difference between the LSVT LOUD program and traditional speech therapy, because on the surface, they might look similar, but the structure and intensity are actually quite different. Let's look at the overall big picture between LSVT LOUD and traditional speech therapy. Traditional speech therapy, it's more flexible and there's a higher level of variability. Whereas the LSVT LOUD program, it's a highly structured and intensive program with a very specific goal. LSVT, it's not the louder version of traditional therapy. It's a motor learning program designed to retrain how the brain perceives effort and movement for voice and speech. A major difference is intensity and schedule. So, in traditional speech therapy, sessions might be 1 to 2 times per week, which can be spread out over weeks or different months, and the intensity can vary depending on the day or the patient's tolerance. Now, in the LSVT LOUD program, therapy is 1 hour, 4 days a week for 4 weeks. So that's a total of 16 sessions in the course of a month. And each session is high effort every single time. The intensity in the LSVT LOUD program is intentional. Since we're talking about intensity, another difference is the effort level. In traditional speech therapy, effort is often minimal to moderate, and it's really adjusted based on the patient's fatigue. However, in the LSVT LOUD program, patients are encouraged to work at a high effort level, which is usually described as an 8 or 9 out of a perceived effort level of 10. With 10 being the highest. The goal is to safely push effort while maintaining good vocal quality. Another major difference is the focus of treatment. In traditional speech therapy, the focus can be on voice, articulation, rate of speech, breath support, posture, or intonation. However, the LSVT LOUD program has a simple, singular focus, and that is a loud voice. And research shows that increased vocal amplitude is the primary driver for the respiratory and voice system. So everything in the LSVT LOUD program ties back to that one singular focus. Now, what happens during a typical LSVT session? Each session is typically split into 2 parts. The first half, we work on core exercises. These exercises include a sustained ah to build vocal strength and endurance, a high pitch of ah and a low pitch of ah to work on vocal fold flexibility, and salient functional phrases that the patient uses every day. The second half focuses on carryover and hierarchy material. So you would use the same loud voice, but in more complex tasks. Since the session is broken up into 4 weeks, each week builds upon the other. So for the first week, we're working on words, the second week, phrases, the third week, sentences, the fourth week, reading. And for all 4 of those weeks, at the end of reading the hierarchy material, we then work on conversation. So the tasks, they become harder over time with distractions, with longer speaking, and or with additional dual tasks. The goal here is to carry loudness into real life, not just in therapy. Another major difference between the LSVT LOUD program and traditional speech therapy is the use of modeling. In the LSVT program, instead of relying on long explanations, the clinician would model, do as I do. And this essentially reduces the cognitive load that many people with Parkinson's can have following complex explanations. Now for homework and carryover, in the LSVT LOUD program, homework starts from day 1. So you have daily practice on therapy days and on non-therapy days. There's clear accountability, and the focus is on using your loud voice in everyday conversation. In traditional speech therapy, homework may be included, but the frequency can vary, accountability can vary, and carryover may start much later. So when people ask how the LSVT LOUD program is different from traditional speech therapy, the biggest differences are intensity, repetition, and consistency. It's a very specific program with a very specific purpose, and it has been researched to improve vocal amplitude for people with Parkinson's disease and other neurological conditions with similar speech and voice changes. In my next video, I'm going to break down the difference between the LSVT LOUD program and the Speak Out program, because that's another popular question that tends to come up quite often. I'll be posting that video next week, Wednesday. As a matter of fact, for the month of January of 2026, I'm going to post videos every single Wednesday regarding the LSVT LOUD program. If you don't want to miss those videos, make sure you go ahead and subscribe, and of course, turn on your notifications. And by the way, YouTube thinks that this is the next best video for you. I'll see you there.